we take a look at news from Malawi. The country has launched a polio vaccination campaign for children starting from today after a case of the virus was detected in a minor last month. The World Health Organization in Malawi says the vaccine administration aims to target over 2 million children under the age of 5 across various districts. Joining me now is the regional coordinator for polio, UNICEF, Eastern and Southern Africa, Dr. Saumya Anand. Thank you very much, Doc, for joining us this afternoon. So let's start with this first case that was reported in 5 years, the country not seeing any cases of polio, and here we are today. What do we know about the circumstances of this particular case?
So this 4-year-old girl child from Lilongwe, Malawi, presented late last year with paralysis of the right side, right leg and right arm. And her stool samples were sent for examination. And while poliovirus was found in her stool samples, which was confirmed in mid-February. So this child did not get any polio doses beyond the first dose she got at birth. So that is the main reason for why she had the paralysis. And this is a very serious matter, a public health matter of international concern, because it risks all the children, not only in Malawi, but also in neighboring countries.
And that's just it. You've since launched a regional response, taking a look at Mozambique, Tanzania, Zambia, and obviously Malawi. How will the program be rolled out?
We have started since the confirmation last month, and we have been micro-planning both for, how do we roll the vaccines out, how do we cover the different areas over 4 to 5 days in all the 4 countries. Malawi will be starting today. They have all the vaccines and needs required, and their social mobilization teams have also started, and we will be working over the next 4 days. Mozambique and Zambia will be starting on the 24th, which is the Thursday, and Tanzania will be starting on the 27th. And over the next 4 to 5 days, they will try to cover the populations that have been targeted. In a total of about 9 million children will be covered for the first campaign.
With this program, you are looking at targeting 20 million children overall in the next coming months. In some of the most remote areas of these countries, you find that there's infrastructure challenges, including electricity. So when it comes to the storage of these vaccines, are you comfortable that you have the necessary infrastructure?
So over the last 1 month, we have been repairing and maintaining the cold chain equipment. And not only that, for some countries where there were gaps, we have also been able to mobilize cold chain equipment, which is basically equipment that carries the vaccine and keeps them at a safe temperature from other areas as well. And over the months, procurement will be ongoing with thanks to partners as well. So the equipment is there and the preparation is there. All we need to do is appeal the parents to make sure that all the children under 5 years of age are vaccinated when the vaccinators come and knock at your door, because we have seen this has enormous, potential for spread.
You speak of an appeal, or you are appealing rather to parents to make sure that they are open to some of these people who will be coming to administer the vaccines. Just in terms of sentiment on the ground, I'm not sure if you've been able to measure it in terms of what people are feeling about this program that will be rolled out. You can't do it without them, no?
Absolutely. I think it is absolutely essential for people to understand what risk this entails. I have a daughter, and if I can feel the risk for my child, I'm sure everybody else can. And just to give you an example from Somalia in 2013-14, when the outbreak of a similar nature started with a girl child of 2 years of age. And then through 2013 and 14, one of the last cases was an adult male who died of the disease. So the disease has potential to kill, but also paralyze children for life, because there is no cure, and the only way to stop it is a vaccine that prevents.
Dr. Saumya Anand, Regional Coordinator of Polio, UNICEF, Eastern and Southern Africa. Thank you.